YouTube channel. I am Adesh Chintalwar, final year student from TNMC BYL Nair Charitable Hospital, Mumbai. Okay. And these are all my seniors. And thank you, Prajwal sir, आपने ये idea दिया मुझे. And ये वीडियो है Plab versus Neet versus USMLE. Okay. और यहाँ पर है हमारे साथ डॉक्टर हर्ष गज्जर सर. He has completed MBBS from RM Cooper Hospital and SBTMC, Mumbai, and secured an All India rank of 179 in NEET PG 2023. And we have my super senior, Dr. Prajwal Kadam sir,
Thank you.
completed MBBS from TNMC BYL Nair Hospital, Mumbai, and cracked a Plab in 2023. He has obtained a GMC registration with license to practice in UK. And we have our brilliant guy, most Dr. Rishi sir, completed MBBS from our TNMC BYL Nair Hospital, Mumbai, cracked USMLE Step 3 in November 2022 and will soon join as a PGY1, means postgraduate year 1 in internal medicine at University of Illinois College of Medicine, Peoria. Okay, sir. Okay. सर कैसा लगता है, मतलब मेरा तो पहला क्वेश्चन आपको ये है कि आपको कैसा लगता है ये एग्जाम क्रैक करने के बाद? हाउ डू यू फील? तो स्टार्ट करते हैं. यस सर, हर्ष सर से स्टार्ट करते हैं.
Okay, so first of all, thanks for having me here. It feels great to be on the other side, and honestly, I feel happy and happy that I could make everyone around me proud. So it's a great feeling, yeah.
सर सर यही क्वेश्चन मैं आपसे पूछना चाहता हूँ. प्रज्वल सर बताइए, मतलब कैसा लगता है प्लैब क्रैक करने के बाद में?
I mean, of course, first, thank you for having me here. And of course, it's a surreal feeling to be able to do this. And I mean, along with the academic challenges, we also have this extra stuff going on that, like, we have to give an exam in different countries. So, adjusted over there. And so glad to have that successfully. And let's see what happens next.
एंड ऋषि सर, आपको कैसा लगा, मतलब ये फीलिंग कैसा था जब आपने एमएलई स्टेप 3 किया?
स्टेप 3 तो एक था, स्टेप 1 स्टेप फर्स्ट गुड. द फर्स्ट थिंग इज वी ऑल एंड इतने भी 1-2 साल में लग रहा है कब अपन रेसिडेंट बने. फ्रॉम स्टूडेंट वी डू समथिंग एल्स. So it definitely feels really great that we're finally going to start residency, and we have so it definitely feels good. Looking forward to the next phase.
Sir, my first question is to you, to the MLE and the Plab candidates. And मतलब आपको ऐसा क्या लगा कि आपने नीट छोड़ के कुछ अलग करने को ट्राई किया है फिर? क्योंकि 90% पीपल्स नीट की तरफ ही देखते हैं, जैसे अपने हर्ष सर ने किया. ओके, सो आपके मन में कब ये ख्याल आया, या फिर
I think yeah, Rishi should start first. Yeah.
The first of all, I never planned to do USMLE at the beginning. I even started preparing for NEET in my second year. But the thing is, I got in touch with some of my USMLE seniors and also one of my dad's friends who's a nephrologist in the US. I had a talk with him, and the thing is, he talked about the training over there, internal medicine, how it is done. I was always interested. I don't know. My dad is in internal medicine, so I always wanted to do that. And he told me about that training and also how there's more focus on evidence-based medicine. There are more research opportunities. So I think that changed my direction. And even though I had started preparing for NEET in third year, I changed my path and I started preparing for USML in my third year. So yeah, I think talking to people who have already gone through that phase and what the life you want, that you should choose that. Yeah.
Prajwal sir, what motivated you? What motivated you?
Just Rishi said, I think he thought of getting into USMLE quite early, like he said, in second year. For me, it was a bit late, I would say. The thought first came into my mind during my internship. So just after my first month of internship, general surgery. So it's just that I couldn't imagine myself working for 3 more years in this kind of setup. So I definitely had options like USMLE and Plab to think about. So for USMLE, I thought that I'm a bit late to start, and definitely USMLE takes time to go through all the step 1, 2, and 3.
So when did you get to know about Plab or MLE?
So yeah, like after my first month, I got COVID, and so like I had pretty much time to myself to think about all of these things. So um, there were a few of my seniors who actually had gone through the MLE route. So even they suggested me that if you want to like go abroad but not choose the US MLE path, so you can definitely look into the Plab thing, because for Plab it's usually an ideal time to start an internship. So like it was only during that time that I gave it a thought, and yeah, I mean, I really don't regret my decision till now. So yeah, let's see.
So Harsh sir, my next question to
Yeah.
you. You 100% you know about Plab and MLE. Why did you choose to crack NEETs or stay in
Acha.
India?
So it's an interesting story. So Prajwal and I, we were going to prepare for Plab together. So in my internship time, I 100%, not 100%, but 90% sure that I was going to the UK. Then I always wanted to take surgical branches, talk to people, talk to consultants there, and they suggested me to get my PG done from here. And if I wanted to go to the UK ahead, then I would have the choice either to stay back in India or go ahead. So yeah, and then I changed my plan in internship. I took a drop and then gave the exam.
Sir, it takes so much patience. Oh, you have so much motivation then.
Yeah,
Okay, sir,
thanks.
what do you think about the ideal time to start MLE or NEET or Plab study for our juniors? What should be the
So
ideal
I
time?
would about USMLE, I would say the earlier you start is always better. I think given that step one at my time was the score, so step one has become pass fail. So definitely you can crack it faster now, and you should start it at least in second year end or third year. The earlier you start, it's better for you because after step one you have to apply for electives and rotations in the US. So it's easier because you can apply early, you can get electives at good places in final year internship. So I would say as early as possible, and second year, third year, I guess you should start preparing for step one.
So
Okay,
yeah,
so for NEET PG, okay, Prajwal, you go ahead
no,
first.
Harsh, go ahead. Yeah.
Okay, so for NEET PG, most of the people know that many start preparing for from second year, but the best time would be to prepare it from third minor. So that is the time when you join your classes, coaching institutes. I think the best thing would be to focus on building the concepts in first and second year, and from third and third major, you actually take your direction of your study towards NEET PG and focus on MCQs and all the things that are required in NEET PG. So I think the ideal time would be third minor.
Prajwal sir,
And yeah,
what should
and
be the
for
ideal?
Plab, I think the ideal time would be during your internship, like after your final year, because for Plab 2, you require your primary medical qualification in hand to proceed with the ECFMG certification. And also at the start of internship, you can give your OET as soon as possible, then give your Plab one if you feel that you have enough time to study along with your internship. So yeah, I think internship would be an ideal time to start.
Okay, so Plab doesn't need a big time plan. Okay, you can start anytime. Plab has an advantage
Uh,
over MLE or not?
Yeah,
What do
of
you
course.
think?
The same thought came into my mind as well when I was deciding whether to go for Plab or USMLE during my internship. As I said, for USMLE, I thought I was a bit late, so Plab was definitely a good option because it fit into my timeline. So that's one of the reasons that I chose Plab. So yeah, definitely an advantage. I think so.
So, Rishi sir, my question is to you. How
Hmm.
did you balance your studies and the preparation? So, you have cracked a step one in second year. So,
Actually, I started preparing actually no in third year, and I gave myself one at the start of my final year. So the thing is, you have to balance both things because you have to give priorities to what you are doing. For example, at that time, I was in third year, so I guess university exams were a part of your curriculum, but not that important for me. I didn't give much importance to that. I know, okay, we can crack those, but step one was really important for me because this was going to decide my future. So I was planning both, and but I focused a lot on my step one and how much ever required university. I did the bare minimum part, and so on that part because I knew step one was very important. But you have to balance both of these things because you have to keep in mind that you can't compromise on your entrance exams. I think you should never compromise on that because these are going to decide your future. So yeah, definitely. But I was focused on that, and since my third year I started, and I gave it in the start of my final year. Yes, but I was able to balance it because you have to decide what to study, and you should have a proper schedule what you're going to do, and you have to stay focused till that time. Yeah,
So how did you
I think
manage
it's up
your
to.
internships and electives that you have to give in US?
So in internship depends basically. So the thing is, whatever time you get an internship, you need to study because whatever time I got an internship, I was taking my iPad everywhere. I used to study in New World everywhere. And even if you have good culture in, for example, I had good batchmates, good co-interns, so I they used to manage my duties and all. So if you can help with that, if you can adjust your duties, if you can, all of your batchmates help you, they also have to study, so all of them work together and do that. So it's up to you how you manage it, but whatever time you get, I used to get home, I used to start studying immediately, and whatever time you get, you have to study at that time because internship may you don't have that much time also. But if you manage it well, and so I started preparing for step two at the start of my internship and gave it just after my internship. So the whole internship, I jitna bhi time I used to get, I used to study for that. So yeah, it depends on your friends, on your batchmates also, definitely what group you have, and yeah, you have to manage it on your own somehow. But you have to think that whatever time I get, I should do it. That's it.
So Rishi sir, how did you manage your internship duties and the studies? Because Neet PG, because the Mumbai colleges has a hectic internship.
Mhm.
Yeah.
So I guess I told you. So I had two of my friends who were also applying for USMLE with me, who were also giving step two. So we had a good study group also. We used to discuss questions and all. Even when we were in the duties, we used to discuss about that. And at the end, I think where I used to request my residents, can you please leave me early or please give me a holiday or something. And they used to, whenever you tell them you have to study and all, you can finish your work earlier, they give you an off or something. And I used to manage in that those things. So you have to definitely adjust everything. You cannot do it if you want to work on completely an internship and also study. That's not possible. You definitely have to adjust everything. I used to request my residents to give me an off or something, and even when I went for electives during internship, I used to study a bit over there. But mostly, I had to adjust a lot of things. And also, if you have a good group where you can discuss questions with them, discuss studies with them, it's very important. I had two of my friends who were giving with me, so I used to discuss with them a lot. So basically, yeah, that's how I did it.
Sir, my next question is to Harsh sir. Harsh sir, what are your thoughts on reading standard books in our UG?
Okay, so I think I have basically read from all the standard books, and it's paramount. The importance is paramount. I think everyone should read from the standard books because the concepts that I developed in my first and second year were as useful as there that time, as useful in the NEET PG also. So I think focus on standard reading standard notes, standard books, and then I think when you get nearer to your MUHS exams, you can just read the IMPs. But I think that is only 1 month. But your entire second year, first year, you should read standard books and not focus on only the IMPs. Only at the last 1 month or 15 days of the MUHS exam, you should read your IMPs.
So, Prajwal sir, I have a question for you. So, how you were devoted to your study when you start preparation for Plab? That's the
Uh,
point when you changed your mind from Neet to
yeah,
Plab, and yeah.
yeah. So yeah, I mean, I was completely pro NEET till my like first month of internship. So But as soon as my internship started, it was really hectic, to be honest, because I was posted in general surgery department for my first month, and I feel that it is one of the heaviest posting to go through. So I sometimes thank myself to have gotten COVID to give it
Think about it.
think about it. Yeah. So for me, I think the most important thing would be to plan ahead, because for Plab, I think Plab 1 and for both Plab 2 as well, planning ahead is really important, because the seats, the booking only is there for, I think, 3 or 4 times a year. And to be honest, if we consider now, I think the next Plab 1 date would be, if someone plans to give Plab, then he'll get a date of, I think, August 2024 or something. So the applicants have definitely increased. So I think planning ahead would be the most important thing. And luckily, everything fell in place for me. So my Plab 1 was during my last month of internship. And I think, as Rishi said, you need to have good colleagues, so who can, adjust for you, adjust your posting. So, and of course, residents are helpful as well. And it depends upon your posting, I mean. So luckily, I was posted in community medicine. So I did not have that much of workload, so I could definitely manage to sneak in some time for my preparation of Lab 1. But yeah, I mean, definitely you can't take your entrance exams lightly, because just in case, if you lose out on like one date, if you fail your Lab 1, then you'll have to wait another 6 to 8 months to give the same exam. So of course, it requires patience, and it's definitely daunting. So you should definitely try to give adequate time for your preparation as well, and just try to manage all these small things, like Rishi said, requesting your residents, and having a good group of friends who can adjust your postings for you. So yeah, I mean, it depends upon person to person, but yeah, and these small things really help.
So my question is to Rishi sir. So what type of questions they ask, or the pattern, or the study mantra you followed for USML?
So USML is kind of a different exam as compared to NEET, because most of the questions you get are kind of clinical presentations. They'll give you a patient which has this features, then what kind of clinical course the patient is having. You either have to find the diagnosis, or you have to see what kind of things they are. For example, so there's a basically a clinical presentation, and there's also a part of ethics in that. For example, what kind of how response to patients, how something, and how will you respond to them, how to ethically manage a situation. Those type of questions are also biased, also there. So there are multiple types of questions which you see in USMLE. Even you have questions where you have to identify the heart sounds and everything. And so you have to prepare. So basically, first aid for step one, I would say first aid and UWorld. These are the two most important things you have to do. UWorld is a source which is, I think, I found the most important thing in my entire life of medical school, because UWorld has everything. Their explanations for every question are so beautiful. You can actually learn. You have to use it as a learning tool. You cannot use it as a testing tool, because you have to solve all questions, and every questions you have to review everything, because it's the explanations are so beautiful. So I think UWorld was something I really liked, and revising UWorld, the notes which you prepare, and for step one, uh, 3 4 times at that time, and you should remember everything from that. And so this is very important, and for more videos and all. So there are a lot of resources which you can find online, but you should all focus on UWorld. UWorld is for all. You have UWorld anyhow. So I focus on how well you can do and how good you are at that. Yeah.
Sir, I think most of the students are using first aid book for every exam, or for NEET PG also, and I think some people,
NICT.
yeah,
Aid is something
INICT.
you will see. It has everything in short, and everything. It covers everything actually, whatever you see. And the first aid is such a thing that focuses on the highlights of every important topic you have to find out, and it's in short. For example, it's not like they're going to go into depth of every important thing is present, and it's in a good advised, and it is mannered properly. So I think, yeah, first aid can be used anywhere in any exam. It's very useful. Yeah.
Sir, have you used it is for Harsh sir. Have you used
Yeah.
the first aid for NEET?
So I had used the first aid only for microbio and physio, and that is only for INI-CT, but not as such for NEET PG. But I think it's a good book. It gives everything in concise format, so you can revise it at the end if you have read it before. So yeah, it is good, but only if you have read it before.
Sir, Prajwal sir, so what was your study material for Plab or anything special you did?
So for Plab 1, I feel there is really less of an offline material to go through. You definitely have your Oxford Clinical Handbook of Medicine or Emergency Medicine for that matter, but most of it is usually the Q bank. So first one, like the most popular one, would be Plabable. So Plabable usually has questions which are, if not at par the exam level, but I think it's sufficient to go through that a couple of times. And another question bank that has come up is Med Revisions. So Med Revisions has questions which is slightly above the difficulty level of the exam. So it definitely prepares you well, but it is a bit vast to cover. So I think for preparation of Plab 1, if you follow both the Q banks, then I think it will take around three months should be ideal enough, 3 to 4 months maximum, if you are working side by side also.
So what do you think?
Yeah.
What do you think? Need is difficult or Plab?
The thing is, I mean, this is a really common question to compare NEET with Plab, and quite a lot of people think that Plab it just requires like 3 4 months, couple of months to uh, like prepare and give the exams. But the thing is, Plab is just a licensing exam. Unlike USMLE and unlike NEET, where you crack an exam and you directly get into residency, but that's not the case over here. You have to clear your Plab 1, you have to clear your Plab 2, then you get your GMC registration, which is just a license to practice in UK. It does not guarantee you a job or a residency. You'll have to sit for another set of interviews, build up your CV, and then you'll get into residency. So it's I mean it's a completely different ball game, and you really can't compare NEET PG to Plab pathway. And because the actual game starts after Plab 2 once your registration, and so that's why like there are this they're not really similar as compared to the level of toughness or something like that. So and going back to the resources thing for Plab 2, I think there are many academies as well. So quite a lot of people prepare over here through online coaching and then go to UK, I think 1.5 months or 2 months before their Plab 2. And
To add one point to Prajwal, what he said. The thing is, USMLE requires USMLE is not only exams, because the thing is, you clear exams, you are not guaranteed a seat. USMLE has everything because you want to create an application. Your CV is very important. The research you do also matters a lot. The rotations which you do, your letters of recommendation from the US doctors and all, when you go for rotations over there, then you apply for the match season, which is the residency interview season, which starts, and then you get matched. So in that you have to give a lot of interviews and all everything. So when you compare NEET and USMLE and Plab, the thing is, NEET, you give an exam, you just it's done. That's part is done. But for NEET, USMLE and Plab, after exams, yeah, specifically USMLE, after your scores are also important. And after that, what recommendations you have, what research you have, how you perform well on interviews, and at the end, then you get matched to whatever choice of program you want. So when you compare NEET with USMLE and Plab, you cannot compare because it's a different ball game, definitely, as you said, because
I,
it's a long
I
process.
I have a different question for you. So can we compare USMLE with INSC?
I don't know much about INICT, but I have heard from one of my colleagues who are
I think I can give that answer
he
after you.
I don't know much about how INIC, but people do use resources of USMLE for INI. So I don't know how the process is, but I think it's a really good exam. It's closer to USMLE as
So
compared to NEET. Yeah.
I
So
think when I gave this November INI-CT of 2022, I found the I won't say it is closer to USMLE because I've heard that USMLE has long stem questions, full page questions. But on the contrary, INICT had 3 4 line questions. It was case based, but in the end, the question boiled down to facts, and that is how it is similar to NEET PG. So NEET PG and INICT you need to have your facts right. Of course, the trend is changing to case-based questions, but in the end, facts and facts, nothing else. So that is how it is different from Plab and USMLE. The Indian exams are different that way.
So, Harsh, sir, for
Yeah.
your NEET preparation, when did you completed
Okay.
your first revision, and the number of revision you made to excel this exam?
Okay.
Hello.
Okay. So first of all, I think it's very important for me to state that I used a single source. I used handwritten notes, avoided any kinds of FOMO. I used DAM's notes. So that I wanted to put that out at first instance, because many students fall into FOMO and they want to get notes from every app that is there. Okay. So basic framework is you have to finish your first revision in 90 to 100 days. Okay. So that is the basic framework. And in that 90 to 100 days, you have to read your notes thoroughly, gather all the concepts that you can. Then you have to give TND, subject-wise test of that subject. And also you can solve the question banks. So I used to solve 7 to 8 question banks every day. So that is the first lead. So if anyone is starting from May, so May, June, July, they should complete their first reading. So, and after that, so the framework goes like 90 days, 45 to 50 days, 30 days, 20 and 10 days. So my recommendation would be to get 4 to 5 revisions before the exam. So 90, 45, 30, 20, and last revision would be 7 to 10 days.
So,
And if you
this
can do
was your
that, I think,
this was
sorry.
your success mantra for the NEET.
Yeah, this is what I followed and luckily got the result. So
you don't have any thoughts in your mind for these exams, Plab or USMLE, or you don't want to leave
as I
it?
told you,
What was it?
no, as I told you, I had thought about giving Plab because I genuinely thought USMLE I was a little late. But uh, after searching about Plab, after going through all the different aspects of the exam and the post-graduation there, I decided to not to go abroad, stay back. And also there is this idea about family, so you cannot take your family
Yeah,
there. So those
because
are
of
the
the
personal
you are a
things. Yeah,
family guy.
yeah,
So
you can
my
say
last
that.
question to all. So what uh, what message you want to give to your juniors? So for USMLE, NEET, and Plab. Start with Rishi, sir.
So I would say decide earlier whatever you want to do. Imagine what kind of life you want. How do you want to proceed? Talk to people, talk to seniors, talk to doctors who have gone through there and all. And I would like to say is do whatever you want. If you're studying, focus on studying completely, give it 100%. If you're enjoying it 100%. I would like to say don't half-ass anything. Always completely focus. Be focused on something you're doing and decide early. It's better for you because whatever path you choose, you are ahead in the game as early as possible. So I think to connect with people, talk to people more so that you get more guidance, especially your seniors and doctors have already gone there. So that's what I would like to
Thank you,
say.
sir. Thank you, sir. So Prajwal, sir, what do you want to
Yes,
say?
I mean, yes, along the same lines, I think talking to seniors and people who are at a place where you want to be or you see yourself in future, I think it definitely plays an important role, and they are the ones who would be the best people to guide you through all of this, and of course, plan ahead because the uh, like if you plan ahead, the better it will be for you because like once you land up in a confusion and you feel like you are also feel your batchmates are doing well and they're getting into residency and you kind of like get into that vicious cycle. So it's better to definitely plan ahead and ask for help, ask for your colleagues, your batchmates, or any seniors. And yes, I mean, just be focused on what you're doing. And even if you have any confusion, try to talk to someone who might help you. And yeah, that's it.
Sir, what do you want to say?
Yeah. I would second what Rishi said, that enjoy whatever you want to do. So I decided to do my internship seriously. So I did that, and then I decided to take a draw. So I did that seriously. So I think you should enjoy whatever you're doing. This PG prep is like a up. There are a lot of ups and downs. So embrace all those ups and downs, and just remember to enjoy, and don't think of it as a burden or a destination. You have to have that rite of passage, have that journey, because everyone goes through it, and you will be successful if you enjoy it.
Thank you, Rishi sir. Thank you, Harsh sir. Thank you, Prajwal sir. Thank you
Yeah.
to have you on my channel. And thank you so much for your guidance. Thank you, sir.
Thanks
Yeah,
a lot for
thanks
having
for
us.
having us. Yeah, thank you.